Hi, Regina.
Well, hello. Wow, can you believe it? We have gone through 6. This is our 7th session.
Yes, and final podcast.
I know. I'm going to kind of miss it. This
Me
has been a
too.
great conversation.
It really has. I've learned so much from what you've brought to these conversations. I just feel so inspired and so much more knowledgeable about how I can move forward in the world.
You know what? I as well. I've learned so much from you. We talk all the time. We've had these conversations, but each time that we have a session, I learn something new and I'm writing it down. And our audience, the feedback has been amazing as well. I mean, they have a lot to add to it, their own thoughts, the way that they've shared it,
Right.
the way they've used it, and other things that they do as well. So if you ever have any thoughts or ideas and you want to let us know, we'd love to hear from you.
Oh, your feedback is so important.
Absolutely.
So important for us to know what you're craving.
Right.
Because maybe there's a possibility we can continue this conversation.
Right.
I would love that. And I want to remind everybody again who we are in case you're catching the 7th episode before you see the first one.
Sure.
My name's Dr. Sheri Gibson.
And I'm Dr. Regina Lewis.
And we've come here together through a wonderful collaboration with the Connecticut State Long-Term Care Ombudsman Program through funding with the CARES Act. And I just want to take this opportunity to thank you, the state of Connecticut and the Ombudsman Program, Mairead Painter, who I've collaborated with, and her team of ombudsmen. We are so, I think, grateful and just feel very privileged and honored to allow this opportunity for us to share our knowledge and to hopefully inspire other people to do better in their lives and have a deeper appreciation for residents living in long-term care and the people who care for them and families and loved ones who are on the other side.
Absolutely. But
them.
this would not have happened if the state of Connecticut didn't have the vision.
Right.
Didn't have the empathy and the compassion to understand this work.
Right.
And the combination between you sharing your expertise in general of what we can do and the challenges behind it, and then I bringing in that cultural layer to be able to be culturally responsive during these times and all times is so important.
So important. And as we wrap up this series, you and I talked about how would we want to put a bow on this series, and
Right.
what's the as we look back on the last 6, how do we want to highlight where we go from here?
Sure.
And the things that came up for us is in this podcast is going to be talking about reframing adversity.
Sure.
And as I shared with you when we were talking initially, pulling this all together, 3 words that have come to mind as I've worked in long-term care over the years with both residents and administrators and direct care staff and families, the whole system of care, is that these 3 words that keep coming up for me is persistence,
Yes.
creativity, and resilience.
Yes, beautifully said.
Because these are all things that that I think people have brought and have honed in on throughout this pandemic. I recently read a study that was done through the University of British Columbia, where they analyzed surveys from just about 800 people between the years of 18 years of age up to 91 years of age, both in Canada and the United States. And all of these respondents filled out like a daily journal talking about the level of stress that they felt during the pandemic. And they collected this data for a 30-day basis and during a 30-day span, and had people daily record how they were feeling,
Sure.
Particularly their stress levels. And what the researchers concluded, which I think is really interesting here, is that older adults age 60 and over actually had greater emotional well-being and felt less stressed and threatened by the pandemic compared to younger adults between the ages of 18 and 39 and middle-aged adults between the ages of 40 and 59. And what that really highlights for us is it's a reminder of the resilience that older adults have.
Absolutely.
And the coping skills that they have honed over a life lived and wisdom gained that carries over into this particular time or phase of life.
Wow, just hearing that is powerful. So, I believe that if you are a healthcare provider, then that's a resource for you to be able to talk to those individuals who maybe you're caring for. Some of them may be able to provide you with where their strength comes from.
Right.
Where are they resilient? And what makes them persistent to continue through?
Right. And I would imagine you have something to say about, because we talk about, in this particular study, they looked at older adults. So they look at age. But there's got to be something there, too, about different cultures and the resilience that comes from historical. We've talked about it in terms of oppression, for example, right?
Sure.
And that through a lifetime, generations of that people become very resilient, very courageous, very strong through that accumulation of adversity.
Right.
The adversity that they've had to overcome again and again.
Right.
So we talk about older adults, but then there's this other layer.
Absolutely. So I always talk about pulling your strength from the past and being able to not only what you've gone through, but doing the research, doing readings, watching movies, having conversations about people from your culture. What did they do? Because it seems like that will help you to what I call standing up in a crooked room.
Ooh,
Being
say
able
more
to
about
stand
that.
up in a crooked room, because it's so hard. I mean, how do you get that strength? How do you balance yourself and set both feet down strong and be able to stand up? Because we are dealing with so many things that's going to get us off kilter and throw us off. And it's like, do I need to stay down? Do I have to stay down? Is there any way to stand up? And oftentimes we can stand up by just finding out, what did other people do? And there is some strong stories, amazing stories. And even if it's not your culture, you can still learn from others' experiences.
Oh, that is so wonderful. And that's one of the things that a type of therapy that we do in geropsychology, and that is either a life review or reminiscence therapy.
Oh, yes.
And reminiscence therapy is really doing exactly that, asking questions of an older adult, taking that strength-based approach and asking, tell me a difficult situation that you lived through in your life, and how was that hard to manage, and what got you through that period? And then taking that a step further, is there anything about that, the way you coped then, that translates to current day and what you're dealing with right now?
Right.
What was it? Was it prayer? Was it art? Was it music? Was it family? And helping that person, tap back into the strength, reminding a person of the coping skills that they've always had, and that those are still there today.
Right. Some of the most resilient people I know are children, very young children. And sometimes having a conversation with them would blow your mind. I remember talking to this young girl. She was very small. She probably was about 6 or 7. And I said, you're not sad anymore. And she says, no, I'm like the zebra. And I says, what are you talking about? And she says, if a zebra gets attacked, it just shakes itself off and just keeps going. And I thought, wow. So sometimes listening to even our youth, very, very young, I'm talking very young,
Right.
and also to our seniors, it's amazing what we will learn and be able to pull from there, because you are going to be dealing with uh, not just the adversity of the pandemic, but just every day taking care of another person.
Right.
And what are you going through? What new experiences have you had to have? And so, first of all, acknowledging that, recognizing that you are going through it, because you have to name it in order to do something about it.
That's right.
And then when
Absolutely.
you do, it's now, okay, how do I become persistent? Have I been persistent? And understanding what that even means. When you are persistent, that means you can continue. You don't have to stop. You don't give up. You keep going. As opposed to being resilient. Resilient is when you go through adversity that can take you down or has taken you down, and you get back up again.
You bounce right back up.
Yes. Once you identify those areas, then you can become creative. You can come up with different ways of doing that.
Different ways, exactly. The creativity. I think about one particular client that I worked with several years ago, and he was in his 80s, and African-American man who had pretty severe dementia. And I asked him, I gave him some cards that have values written on them. And we went through them and asked him about what his values were. And one of his values was faith. And so I asked him to tell me who taught him that value of faith. And he told me that it was his grandmother. Now, this gentleman was 89, I think, when I was working with him. And his grandmother was a slave. And he told me, see, that's interesting, because that's what happens, I get taught. He told me that his grandmother and his mother would sing songs, hymns on the front porch, and that he felt such a strength and connection to his religious faith through those singing of hymns on the front porch. And so I asked him if he would sing me one of the hymns that he learned as a child. And that's how we would connect at every session that I met with him. He would never remember my name. He would never remember what we talked about the previous week. But I tapped into the thing that was so important to him.
Yes.
And his daughter, who was his caregiver, was really kind of, we talked about compassion fatigue on one of these podcasts, and she was very fatigued in her caregiving, and she would get frustrated with him. He would get frustrated with her, and they'd argue, and it was just really tough. And so some of the work that I did with him was taking him to a happier time.
Yes.
And what I noticed in doing that is that his anxiety and his agitation would I could see it melting off of his body as he sang, as we talked about and reminisced about earlier times. And I think that those are the things that we all have an ability to do. I often say that all of us, can be therapeutic without being therapists.
Yeah. Oh, I love that as well.
We don't need to be therapists to be therapeutic.
Sure.
So that's just one way that I think about how his persistence in his life, his resilience, and my creativity to bring that out in him in that very moment. That's a really, that was a powerful exchange and a powerful client.
When you said tap into what is important to that person, I believe that that's key, because people will light up. You'll actually start to see the lights come on and their eyes open up, because they now are talking about something that they care about, and they see that you value that, and the conversation becomes amazing. So I just love that you said that. That was fantastic.
Yeah, thank you. Well, and I'm sure that so many of our listeners out there have their own stories to share. And in fact, I would love for when you've done listening to the podcast, if you'll share some of those stories of resilience and
Yes.
perseverance or persistence and creativity that you've used in your work or your caregiving, or even for those residents who are listening, if you could write down, maybe give us some feedback about things that you've done. What gets you through this time? Because I think what is so helpful is we learn from one another.
Mm-hmm.
I've learned how to take care of myself
Mm-hmm.
by
Mm-hmm.
learning what my friends and family and colleagues do to take care of themselves. Right? It's
Absolutely.
a shared
Absolutely.
experience, and I just hope people will write in. I'm really curious to see what they'll have to say.
I am too. I would be very excited. I know that something that we did in our family to be creative was each one of my siblings had a picture of themselves, and then they wrote a one page about a time when with my mother. You know,
Mm.
they remember and how that impacted their lives in a positive way. And so once I received all of them, I put it into a picture book. And then my mother, I had her read each one and I recorded it
Mm.
so that later in life, I will share with each one of my siblings the story that they wrote to my mother, but her reading it back to them.
Oh,
It's going to be
lovely.
powerful, and it's something that they can use long term and can be passed down from generation to
Yeah,
generation. So there's just ways that we can be creative.
that's right. That's
Hmm.
legacy building right there.
Absolutely, it
That is
is.
amazing.
Yes,
There are so many ways that families stay connected during this time.
yes.
Something that my family did when my grandparents were living is my sister and my mom and I wrote on tiny slivers of paper our favorite memories with our grandparents.
Oh,
And we put them into a jar
hmm.
and we sent them to our grandparents. And every day they would pull out one of our favorite memories,
Oh,
and
I
it would
love
give
that.
them a conversation starter to reminisce and to talk about what they remembered about that
Yes.
memory. And it was just they talked about it for years, how much they loved opening a new sliver of paper every day.
I love that. I'm gonna do that one.
It's a great
That's a great idea. I kept thinking, how do I get them to make 365 of those?
Right. Exactly. That's got to happen over time, right?
But also there's something in being able to do it again, the
Hmm.
repeat of
Hmm.
information. So you have some and then you pull it out again. It's like a reminder. I
Right.
believe that there's some value in that as well.
Hmm. Very
Wow.
much. And isn't that embedded in all of these types of activities that we can do to build connection? There's so much strength in that. There's optimism in it. There's hope in that.
Oh,
It's a
yes.
lot of hope.
Oh,
Yeah.
absolutely. For so many and for so many reasons.
Hmm.
I believe that it's fantastic.
Hmm. Me
This
too.
is fantastic to be able to do that. It goes back to what this is all about, reframing adversity. Sometimes when we look at adverse situations, how can we reframe that? Even just the word itself. When we think about adversity, we think about it on the negative side. We
Hmm.
think about it taking us down
Hmm.
and hopelessness.
Hmm.
But if we look at adversity in another way to say, this shows how strong I am.
Hmm.
Brings me to the challenge. Everything I've learned, everything that I prepared for is for today.
Yeah.
And how can I put that to work and get through this? And when
Right.
you use persistence and resiliency and you're creative, then you're able to say, all right, I'm laughing in the face of adversity.
Mm.
Yeah, it
Right.
becomes powerful.
That is very powerful. And I would imagine I would feel empowered by that
Absolutely.
statement. By that statement. Um, I was thinking about how persistence has really been noted throughout our country,
Mm-hmm.
throughout this pandemic. Uh, you know, in the early moments of the pandemic, early days, remember how we saw people clapping outside of their apartment windows, or and honoring the nurses coming home.
Yes.
In Italy, you heard people singing out of the windows. In my own neighborhood at 8 o'clock every night, people howled
Oh,
And it
wow.
went on for months. And
Wow.
there was a group of kids down the street that I'd go outside 8 o'clock. They were always howling, and you could hear it in the neighboring developments. And it was something that, yes, creativity, but it also meant that you weren't alone.
Right.
You felt the combined voices of people you didn't know, you never met any of them, but it felt like we were coming together. We were sharing something important in that moment. So, some persistence there. I also want to talk about persistence of families in remaining connected to their loved ones, especially who live in long-term care. The persistence of ensuring that they are communicating with their loved ones, whether that is going to the window every day or once a week, or using FaceTime or other means of technology to stay connected. That's very persistent. I'm thinking back to a gentleman that I worked with whose wife was transferred into long-term care after she had suffered a stroke. And it was right about that time that COVID hit.
Yes.
And so he couldn't go to visit her. They'd been married for 60 some odd years. And it was a very sad time for him. And he would come to my office crying, talking about how he sat on the other side of the window watching his wife and just feeling very hopeless in that. And he went every single morning to look at her, to watch her. And he would say, I feel guilty going home to the home that she built, that in sitting among her things, and this isn't the life that we wanted for ourselves.
Right.
We worked through a lot of that together. And I got a call from him, and he said, well, I went against the wishes of my own children, and I went and got her and brought her home.
Oh, wow.
So he checked her out. And this is a story that we've kind of heard across our country of families having to make some decisions that are very hard decisions. He was fortunate that he could provide in-home care for her. And he actually brought her to the session, and she was very progressed in her dementia, but she was very happy to be with him.
Oh.
And he was touching her in the session and crying, just joyful tears that she was home. And then about a month later, I got a text from him or email that said he had lost his best friend to her third stroke.
Oh.
And now he was dealing with the grief of that. But this is a story, like many stories across our country, of persistence in families.
Absolutely.
Persistence in showing up, in being connected, making tough decisions. Might be decisions that are against what other family members want, but staying true to one's own self and to the values that that person held around his marriage, around what he could live with. Absolutely. And being able to live with that after she had died, that he'd done the best by her in their family.
I'm sure that there are people in our audience who are struggling with a decision that they want to make, that they believe is the best decision, but it would go against the grain of the rest of their family. And hearing that story, I believe, really would help them. I know that I have a friend and a pastor who was suffering with cancer. And he had what he called the God Squad. And it would be individuals that would go with him to his chemo. And each time there was a squad that would go, they would dress in different themes and have something for him as well to wear. And they would have different themes, the Wizard of Oz, cooking, what have you. And it made the people around him, who was also going in for chemo, feel better as well. They could enjoy that. Right. During these times of, having to be able to have to be separated and having masks on or what have you, we did a masquerade
Oh,
party.
wonderful.
And everybody made faces on it. They did different things. And so in those times, it still could be seen as a place and a space to come together.
Right.
I think
Yeah.
that's important.
Yep.
Yep.
And the creativity around that.
Oh, yeah.
Rethinking what engagement means
Yes.
has been very important for us,
Right.
right? Yeah,
Right.
especially in long-term care. Some other thoughts that I was having about persistence as well is that the persistent advocacy of ombudsmen in long-term care. These are ombudsmen are the voices of the residents,
Mm-hmm.
and the long-term care staff also, who take a person-centered or a person-first approach to their care, to providing care. There's a lot of persistence in that. There's been creativity that's had to happen. I know for ombudsmen across the country, when they could not go into facilities, that presented a real challenge for them in being advocates for residents. And
Sure.
now, as they are rephasing or re-entering into long-term care communities, they have additional challenges around that they're having to be creative with. So, for example, going back into facilities or into communities where people may have died, residents that they were
Yes.
advocating for prior that they might are now deceased, or also just the unknown of what they
Right.
are walking into. And so that creates an opportunity, but a lot of persistence happens
Yes.
within that approach.
Absolutely. I think that all of these pieces that you're sharing with me and with our audience is so important because it starts to turn on a light that says, you know what, I can do this.
Mm-hmm.
I don't have to stop here. Reframing and seeing it differently
Right.
is what really is what's going to get us to the next point.
Mm-hmm.
And know that this is not going to be the last. This is not going to be the last adversity that we must face, but it is a place that we can now leverage
Right.
the next time that we're faced with something, whether it's a nation or just an individual.
Right.
Yeah.
We're going to come out the other side.
Yes, we are.
And
Yes,
well,
we are.
one, we're going to come out the other side. We're going to come out stronger,
Right.
more resilient,
Right.
more creative,
Sure.
educated,
Yes.
and more aware.
That's right.
And that is an amazing place to be, isn't it?
That's what all of these series were all about. This
Yeah.
entire series was about being able to do those things.
Right.
Look at them again and again and again, because they're going to provide you with little nuggets that once they're planted, it's like a seed. It'll bloom and it'll grow, and it'll help you to think outside of that. Remember that, yes, although we can only control our controllables, there's a lot within that we can actually control.
That is so true
Yeah.
and beautifully stated, Regina.
Thank you so much, Sheri.
Well, I want to just thank you again and thank our listeners. Thank you to the state of Connecticut and the Ombudsman program
Sure.
for providing us with this opportunity to share, to learn from one another, to get feedback from all of you about how you've responded and reacted to this series, and to give our best wishes to you and your family. Continue to hold the hope that
Yes.
there will be a better tomorrow.
Mhm.
And just, again, thank you so much.
Yes, thank you, Sheri. It
Welcome.
has been a pleasure working with you.
Same. All right.